speech disorders. These language and speech disorders are complex communication conditions that affect an individual ability to effectively communicate, both in terms of understanding and using language, as well as producing clear speech and utterance. Language and speech disorders refers to problems which on or both or person's ability to understand and express what is being said. Speech and language are two different concepts that are often confused in daily life. Language and speech-related disorders are different.
Here are examples of language disorders commonly seen in people with schizophrenia. First is loosening of associations. Is the person jumps from one topic to another without a clear connection. Second is neologism. Is the person creates new words that don't make sense to other but have meaning to them. Third is word salad. Is words are mixed together in a way that doesn't make sense. The fourth is tangentially. Is the person gives answers that are unrelated to the question or go off topic. Fifth is perseveration. Is the person repeats the same word or idea over and over, even when it's not relevant anymore. Sixth is clang association. Is words are chosen based on sound or rhythm rather than meaning. Seventh is echolalia. Is the person repeats words are phrase said by someone else. And the last is talk blocking. Is the person suddenly stops taking in the middle of a sentence as if they forgot what they were saying. Thank you.
If we discuss about the causes from language and speech disorder, range from biological factors such as genetic, actually brain abnormalities or hearing loss, actually to environmental factors such as lack of language stimulation or emotional trauma. The consequences, language and speech disorder can be wide-ranging, from difficulties in social interaction to problems in learning and working.
So, what are the characteristics of language disorder? The first, difficulty speaking or understanding language, and the second, difficulty finding the right word, and the third, difficulty understanding instruction or commands, and the fourth, difficulty following conversation, and the last, difficulty reading and writing.
Language disorder in individuals with schizophrenia can significantly affect in communication. Here are some of the key effects. The first one is disorganized speech. Speech is often incoherent, difficult to follow, or jumps between unrelated topics. The second one, called neologism, creating new words that are not recognized by others. It's making communication somehow very confusing. And the next one, called echolalia, repeating words or phrases spoken by others without adding meaning. And the fourth one is prosody disturbance, abnormal intonation, rhythm, or pitch, making it harder to convey or interpret a emotional context. The fifth one is delusional ideas. Conversations are often influenced by unrealistic belief or hallucination, leading to communication that doesn't align with reality. And the last one is lost focus. Difficulty staying on topic with frequent interruption from internal thought or distraction.
How the treatment of schizophrenia. First, taking antipsychotic medication. Second, speech therapy to improve their speaking skill, understanding conversation, and use other ways to communicate. Third, physical therapy. Therapy like CBT or cognitive behavioral therapy help patients understand and change negative thought patterns that may worsen their symptoms. And the last, health professional team. Treatments involve a team of experts including psychiatrists, speech therapists, and psychologists working together to provide the best care. So, treating schizophrenia is not just about taking medication. They also focus on helping patients communicate better,